A special thank you to each of our subscribers who make this channel possible. Here's today's story. In a dramatic turn of events, the Senate is moving forward with a contentious domestic policy bill championed by President Donald Trump, which is projected to significantly impact health care coverage for millions of Americans. According to a recent report from the Congressional Budget Office, CBO, the proposed legislation could lead to an additional 11.8 million Americans becoming uninsured by the year 2034. This alarming estimate has raised eyebrows among both political analysts and healthcare advocates, as it marks a considerable increase in the number of individuals losing their health insurance compared to earlier versions of the bill that passed in the House last month. The CBO's findings indicate that the bill would result in more than $1.1 trillion in cuts to federal spending on vital health programs, including Medicaid, Medicare, and the Affordable Care Act, Obamacare. Notably, over $1 trillion of these cuts would come from Medicaid alone, a program that serves millions of low-income Americans and is crucial for providing essential health services. As the Senate gears up for a critical vote, the political landscape is rife with tension. Senator Thom Tillis of North Carolina, a key Republican who recently voted against advancing the bill, announced he will not seek re-election in 2026. His decision has sparked speculation about the motivations behind his vote and whether it reflects broader concerns within the Republican Party regarding the bill's implications. Political groups and business interests have poured at least $35 million into an aggressive advertising campaign to sway public opinion on the legislation. Meanwhile, President Trump has urged Senate Republicans to override the chamber's parliamentarian in order to push through essential components of his sweeping domestic policy agenda. Despite some Republican lawmakers expressing hesitance, the bill narrowly cleared a preliminary vote in the Senate, with a 51-49 outcome that saw two Republicans, Tillis and Rand Paul, joining Democrats in opposition. The stakes are high as the Senate debates the nearly 1,000-page bill, which is expected to undergo extensive scrutiny. Democrats are leveraging chamber rules to force a 16-hour reading of the legislation, aiming to delay the vote and highlight the potential consequences of the proposed cuts. With Republicans holding a slim majority in the Senate, they can afford only 3 defectors if they hope to pass the bill without Democratic support. Critics of the bill, including healthcare advocates and Democratic lawmakers, have expressed grave concerns about the long-term effects of the proposed cuts. They argue that the legislation would disproportionately impact vulnerable populations, including children, the elderly, and individuals with pre-existing conditions. The potential loss of coverage for millions of Americans has prompted widespread protests and calls for a re-evaluation of the bill's provisions. As the debate unfolds, the political ramifications of the bill are becoming increasingly apparent. The CBO's estimates have complicated Republican efforts to rally support, as lawmakers grapple with the implications of adding nearly $3.3 trillion to the national deficit over the next decade. This financial burden raises questions about the sustainability of the proposed cuts and the overall impact on the U.S. economy. In the midst of this political turmoil, President Trump remains optimistic about the bill's prospects, celebrating the retirement announcement of Senator Tillis and framing it as a victory for his administration's agenda. However, the growing dissent among Republican lawmakers suggests that the path to passing this landmark legislation is fraught with challenges. As the Senate prepares for further debate, the future of healthcare in America hangs in the balance. Lawmakers are faced with a critical decision that could redefine access to health services for millions and shape the political landscape for years to come. The coming days will be pivotal as both parties vie for control over the narrative surrounding this high-stakes legislation, with the potential to alter the course of American healthcare policy for generations. That's all for this story. We upload videos every day covering many different subjects, so hit that subscribe button to stay informed. Thanks for watching.